This Docs on Call is brought to you by Excelis, Blue Cross Blue Shield, and UHS. I'm here with Dr. James Wood with UHS Primary Care in Norwich, and we're going to talk about the hemoglobin A1C test. Doctor, what is the hemoglobin A1C test?
Also called a glycated hemoglobin test, is a test that we use to diagnose diabetes. Your red blood cells in your bloodstream has a protein called hemoglobin that binds to oxygen and takes it to your tissues. It also has an affinity for glucose. So if you have high glucose, it forms more links with this hemoglobin, and we are able to check this in your blood, on your blood work. A1C of 6.5 is diagnostic for diabetes. 5.6 or below is normal, and anything between that is pre-diabetes, where you have a higher risk of developing diabetes in the future. We like to keep our diabetic patients with an A1C of less than 7.
So why is it important to check it?
Well, if you check your glucose regularly, you're only taking a snapshot of what your blood glucose is at a particular time. This way, when we check the A1C, it gives us an average over a 3-month period. So a lot of times my patients come and I do blood work on them. They have numerous blood work that's normal, but when I check the A1C, it's high, and they're shocked because the A1C gives us the average over that time.
How often should it be checked?
Well, the check-in corresponds with how long the RBCs last in our bloodstream. They last about 90 to 120 days for turnover time. So we like to check it every 3 months or so. When your diabetes is controlled, we check it at least twice a year, and if you have no diabetes at all, at least once a year for adults.
Mm-hmm. What can someone do if their A1C is high?
Well, it's very difficult to reduce the A1C by 1 point. If your A1C is 6.0, for example, that means that you have blood glucose averaging about 150, because there's a 25-to-1 ratio between the blood glucose level and the A1C. So for you to bring your A1C down by 1 point, you have to reduce your blood glucose average by 25 points over a span of 3 months to 125. The main things that you can do to bring this thing down is to watch your carb intake, exercise regularly, take medications like insulin and other diabetes medications that we have out there.
All right. Thank you, Dr. James Wood with UHS. For more information, go to our website, WBNG.com. If you want to leave a comment or ask a question, call 584-7362, 584-7-DOC.